My name is Viraj Mane. I'm the co-founder and chief scientist at Lactiga. My background was starting in the sciences, finishing a PhD in molecular and human genetics at Baylor College of Medicine in Houston, followed by a postdoctoral fellowship at the FDA, and followed by a second postdoctoral fellowship at the University of Maryland. So I had studied fields including gene therapy, virology, immunobiochemistry, nanotechnology, and some drug discovery and drug delivery. But then I had opportunities to come away from the lab bench, and I was fortunate to be able to support the Department of Defense and the management of their medical countermeasures portfolio. So I was using my scientific skills, but not having to be at the lab bench, and that felt like a good fit for me in terms of career growth. And then I spent several years in the Toronto entrepreneurship ecosystem, connecting startups with governments, academics, large companies, et cetera, and connecting them to like public-private partnership opportunities, including securing funding. And then I was bit by the entrepreneurship bug, which typically happens when you're hanging around founders all the time. And then a very personal story led me to the founding of Lactiga, which was becoming a dad. And noticing that for many new moms, they're pumping milk sometimes late at night, sometimes at work, collecting it into a bag or a pouch, putting it in the cooler, bring it home, stick it in the freezer so that you have it available if you want extra to feed the baby later. You can thaw it, put it in a bottle, and feed the baby. And that's what we used it for. But there was a lot of extra supply that was clear we were never going to use all of it. And I talked to friends of mine whose wives had children around the same time. And we're like, oh, we all have extra human milk or breast milk in our house. And that sparked the scientific idea that if there was a reliable and reproducible and scalable supply of this extra milk, which is how we learned about milk banks, then could that serve as a starting material to purify secretory IgA antibodies, which are naturally abundant in that milk, and to deliver that purified biologic to immunodeficient patients who cannot make that antibody. So that then becomes a one-to-one replacement therapy. And that's some of the underpinnings of the company Lactiga.